When you relax, you become aware, right? And when you become aware, you can learn to concentrate. So let's talk about concentration. That's the second principle listed that we went through: concentration and awareness. They kind of sound similar, don't they? But they are different. They point to different things. Awareness doesn't have a... awareness doesn't necessarily, I'll preface it by saying necessarily, does not necessarily have, I want to say something like direct actions. It's like, this is good. Tuning your witnessing. Meaning that you can tune your mind's eye. So awareness, we might say mind's eye. That you can tune to different places in your body or outside of your body. You're basically able to tune your own mind's eye. So you have to be able to notice where that is. And you're like, awareness means more like, filtering information. It's allowing messages to arise, lots of messages. It's not telling anything what to do, it's witnessing, allowing things to arise. Concentration is directed. You can't have concentration until you've developed the ability to understand you have a mind's eye that can filter information it's witnessing without judgment or need to do anything about it. You have to have this awareness, this base level awareness, in order to then concentrate. So in terms of that, we have to help some students develop this awareness. So how can we develop awareness in our students via things like propping? Again, it's back to somatics and cueing. So cueing. So if I have somebody who doesn't, like, they know, I mean, of course, everybody knows they have a spine or a hip joint, right? They're not dumb, but they don't have a felt sense of it exactly. So if I have somebody who's coming to me because they have a tight hip of some sort, then it's really stiff, right? So if it's stiff, it can't feel, right? That's a problem because stiff tissue lacks awareness. So I might take the globe, heat it up, put the globe in somebody's hip socket, let it relax there. I might cue things that have to do with like sensing so somatic cueing, sensing the weight and the heat and the shape of that globe. Because when I do that, that person has their sensory nervous system is making them develop awareness of a part of their body they're not usually aware of in this way. When we can get that awareness to wake up, then we can ask them to concentrate on what's happening in that hip and in a directed way, to direct some movement, like let's say leg levitations with an exhalation, right, for instance. Okay.